am also a nurse by profession, and have a master's in nursing and a master's in health administration. And as Audrey and Neva have indicated, keep your body moving and be mindful of your levels. What I want to bring to you is the importance of a preventive health screening. I have a 93-year-old great aunt who walks every day that weather permits, her and a neighbor. And so if that's the key to longevity, then let's jump on board. I'm going to start at the top. I'm going to start with not so much our mind, but we know the importance of keeping our mind strong and keeping our stress down. I'm going to start with our mouths, that instrument we use to profess our love for the Lord and one another, and the importance of our dental checks. So first, importance of preventive health screening. Health screenings helps us to recognize early stage changes so that we can identify and use available treatments to improve our longevity and our quality of life. So why do we need a dental check? So prevent plaque, tartar, cavities, and tooth decay. It keeps our gums disease at bay. Gum disease is the breakdown of gum tissue and causes a breakdown of the bone that holds our teeth in place. And dentists also use this check to check for oral cancer. So when they ask you to open up your mouth and stick out your tongue, and they push it from side to side and they feel under your jawline, they're checking for the lymph nodes in your neck that can clue them by training as to that there may be some lymph node involvement and there may be a predestined sign of cancer there. And so a lot of the things that the dentist can do doesn't even need to be an x-ray. I'm one who can't really stand those x-rays. I have a very strong gag reflex, but I have to suffer through that because of the importance of that dental check. We're going to move on down the body and go to our colonoscopy. And I know that none of us look forward to that. After a certain age, at age 50, you are being told by your primary care physician that you need to go and have a colonoscopy. But for us that work long hours and nights, it's a momentary time to get a little rest, because you get a little conscious sedation and get to go to sleep for a little bit and wake up and it's all over. So a colonoscopy is used to help diagnose cancer and other gut-related abnormalities, as well as a screen to cancers and remove them before they become a life-threatening condition. And so, like many of us probably have, when we had that colonoscopy, the doctor reports back after we wake up to say that he removed some polyps, some precancerous polyps that were, they're just precursors, and they've easily removed and nothing of it, and nothing else usually needs to be done because they've gotten that out. Which these polyps usually line the lining of your colon. And then moving on to our mammogram, and another painful test, but momentary in time because it's all for the better good. So 70% of early stage breast cancer patients may not need chemotherapy. So I looked at a study that looked at more than 10,000 women, and the 5-year survival rate in that study from 2010 to 2016 indicated the following information. So if you have a cancer that they consider to be localized, that means there's no sign of cancer has spread outside of the breast. And the survival rate of that is 99%. So if your cancer is designated as regional, your cancer has spread outside the breast to nearby structures as your lymph nodes, which are located under your arm. You have lymph nodes throughout your body, but these ones that are associated with your breast are located under your arms, and it can be an indication if it has spread anywhere else. And so in the survival rate in their 5-year study, that was 86%. And if your cancer is distant or designated as distant, that means that it has spread to distant part of your body, which such as your lungs, your liver, or your bones. And the 5-year survival rate of that is 28%. So given that statistic, so you can see in each stage, early detection and having that information sooner than later betters your outcome. So then keep it on with the women as to why we have to have pap smears, okay? The pap smear or the pap test is a screening test for cervical cancer. Women have so many parts. A second screening option is the HPV test, the human papillovirus test that causes cervical cancer. Now, both tests require cells to be removed when the physician do your cervical check or test. The pap test looks for abnormal cells that may develop into cancerous cells over time. And the HPV test looks for strands of the HPV virus that are most likely to cause cancer. And so they're both similar. So you're looking at the virus itself, or you're looking at your cervical and any abnormalities in the cervical lining. So even if a woman has had a hysterectomy, she still has a chance of developing vaginal cancer. So I think this is kind of the most important part of this whole OBGYN test, because people think that women think that once you've had those organs removed, that there is still no chance or that you can get cancer. So just identify some terms. Partial or total hysterectomy is removal of the uterus. And a partial is a removal of the uterus. A total removes the uterus and your cervix. Both leaves the ovaries intact. So you can still develop ovarian cancer. And when you have a total hysterectomy or saphengo oophorectomy, this procedure removes the cervix, your uterus, and both ovaries and your fallopian tubes. Okay, and that makes ovarian cancer less likely to occur, but it does not remove all risks. So there still is a risk for primary peritoneal cancer. The peritoneum is a covering that lines the abdominal organs and is close to the ovaries. The peritoneum and the ovaries arrive from the same tissue during embryonic development. So that is the embryonic or embryosis is when those cells come together when we are starting to form human life. So just before it becomes the fetus. So it's a conglomerate of cells that are developing. So it is still possible that cancer could result from the cells of the peritoneum. And so with that, we'll move on to our men, who are a little bit more hard-headed when it comes to health screenings and checks. So the men in our lives, our husbands, our significant others, our fathers, our sons, our brothers, our uncles, our nephews, and our male cousins. That whole prostate check with that digital exam, is like, oh no, that's not going to happen. But let's talk about the prostate. The prostate gland sits under the bladder and just in front of your rectum or your anus or your butt, okay? And it surrounds the urethra, which carries the urine and the semen out of the body in the male. The prostate's main function is to help make fluid for semen to help protect and energize the sperm. So the semen protects the sperm so it can fertilize the egg to form new life, okay? And that's kind of what we're here to do, to create and procreate. So that prostate exam helps your doctor diagnose an enlarged or inflamed prostate. And it can help to diagnose prostate cancer, which involves that digital exam where the doctor has to place his finger in your bottom to look for and test for that prostate-specific antigen, which they call PSA. Your PSA levels can also be tested in your blood. So for our men in our lives who was like, oh no, I'm not having that digital exam, still please encourage them to go get that PSA antigen test, which is just to give a sample of blood. So as some men are very stubborn about having that prostate exam, here are some things that they are really more passionate about, what may encourage them to to get it. So prostate cancer is the second most common cause or form of cancer in American men. And of course, in every study, they always say that African-American men are more so than any other rationale, excuse me, ethnic group. But the first exam, they ask men to get around the age of 40. But you want to talk with your doctor to see when you should start your health screening, especially if you have a family history of cancer. And what I want to talk about in terms of familial history or family history, please note that you get 50% of your DNA from your mother and 50% of DNA from your father. So you have to take that whole 100% into account. So don't discount because you're a male or female, discount the 50% that you get from your father if you're female and the 50% that you get from your mother as a male, because it all plays a part when you're looking at your cancer history. Okay, so routine screening starts with a PSA blood test and may involve that digital exam. But note to men that without your prostate, you may have a loss of urinary, bowel, or erectile function. And we know how important that is to you and also to the women in your life. So don't just think of yourself, think of your mate, okay? And so talk to your doctor as to what is the best time for you to start your screening, because it is a determination of what your family history looks like. So they have those in any type of literature, they will have a hallmark time, but talk to your healthcare provider as to when is the best time for you. And then for us people who like to educate ourselves in terms of our health, just want to point out to you, when you're looking on the web and looking for credible information or what sources to best put your trust in, look for those sources that are .edu, .gov, .org. Those are some of the best. Those are the best ones to rely on. Okay. The information or where I gathered my information for this conversation tonight are indicated in the citations at the bottom of this document. But you can Google and random search and find your own as to what you may be looking for at the time. Thank you.
Thank you so much. Wow. Are you all feeling informed? I definitely learned a lot this evening. I so appreciate, especially prevention of disease. I think a lot of us don't think about how much control we really do have in doing everything that we can do to prevent disease. And by just watching some of those numbers. So that PSA, just like Jackie Lancaster just talked with us about, maybe you can't drag him in to get that digital rectal exam, but there is no reason why when he goes for his annual physical, feel empowered. If your doctor is not, or your PCP, your primary care provider is not including a PSA, speak up. You should know those numbers, because we need to watch what those numbers are and whether or not they're elevating, because that clues us in that maybe we need to look more closely, right? As Dr. Robertson mentioned, it used to be, 140 was hypertension. Now, if your blood pressure is over 120, if it's creeping up to 130, hey, even if you're PCP, listen, I'm telling you right now, when they talk about disparities in healthcare, it is real. It is real. There are reasons why the studies show that our numbers are always worse. I thought it was almost laughable when they talked about the pandemic and how we were dying more from COVID, right, than other ethnic groups. Hello, that's been our story our entire lives. We die more from high blood pressure, heart disease, stroke, go right down the list, cancer. So when you go see a provider, especially providers that don't always look like us, I mean, the reality is the reality. If they're not checking it, ask for it. Make sure you know what that PSA is for your partner, your spouse. I don't know if we have any men on the call tonight. Know that number. And then compare it to last year's number and the year before. And if it's creeping up, that's when you need to speak up. If your blood pressure has always been, that top number's always been 120, 115, and now it's creeping up 130, right, Dr. Robertson? It's time to speak up. What do we need to do, doc? Because I don't want to go on antihypertensives. What do I need to do to bring it down? But what we often do, and I want you to encourage anyone that you know, what we need to do is to just feel more empowered, be advocates, ask for your numbers. You go sit there, they check your blood pressure and they say it's fine. Well, what does fine mean? Can you give me those numbers? Right? If it's over 120, if it's in the 130s, well, we need to talk about this, right? Dr. White gave us a good number that we also need to check, and I make sure I check it every year. That's that A1C. So hemoglobin A1C, your blood pressure, that PSA, make sure you know your numbers. If that number starts to creep up, just take your numbers and compare it to last year's. But you can't do that if you don't ask for them. So let's all be advocates, because we are magnifying God. So we need to stay healthy, because we're all walking in our purpose. And if we're walking in our purpose, we need to be healthy to do that effectively. So let's open the floor up. Let's see if anyone has any questions. Anyone need anything clarified? Or if you're not too shy, if you have any specific questions that we can help with. Everyone needs to have their own medical provider. As Dr. Robertson pointed out, we're not here to offer any specific advice, but if you have general questions about how you're going to safely transition off of the Daniel fast, how you're going to maintain your health, what is it that you need to be doing so that you are healthy? We didn't get into a discussion about vitamin D, but I have spoken about that, I don't know, ad nauseum, probably in the January fast. That's one of those supplements that I take regularly. So vitamin D, I also take fish oil regularly. So there are some supplements that you might need to consider if you're not getting it in your diet, because I don't do the dairy, because there's so many studies that talk about inflammation. So that's one of the things I personally have given up with the Daniel fast. I'm not going back. I can have my coffee with my almond milk or something else, but I'm not going back to anything that's going to add or cause inflammation in my body, because as we get older, right, our cells take longer to regenerate, to rejuvenate. So when you're talking about higher risk of cancer, that kind of goes along with age. So someone mentioned rest. Yes, we need to not, minimize our rest periods down to 5 and 6 hours a night. We need to really lengthen that to 7, 8 hours. Get your full amount of sleep so that your cells can do what they need to do. And hydrate. We did really well on the Daniel fast because that's all you could do during the day was drink, right? So continue to hydrate. I gave this formula out a few times. So if you take your weight and cut it in half, whatever your current weight is, cut it in half and turn that number to ounces. That is really the amount that you should be drinking each day, but never go over a full gallon. Stay under a gallon. Just a few tools, things that you all should take with you. So I'm going to stop talking. Sue.